Dr.Sreedevi Yadavalli garu. She's a founder and managing director for Argala Healthcare Services. She's a communication specialist, Tedx speaker, author. So she dons many roles in her life. ఈరోజు ఆవిడతోటి కాన్వర్జేషన్లో ఆవిడ జర్నీ అండ్ హౌ షీ కుడ్ బికమ్ ఇన్స్పిరేషనల్ ఫ్రమ్ వేర్ షీ స్టార్టెడ్ టు ఫ్రమ్ వేర్ షీ ఈస్ టుడే తెలుసుకుందాం మనం.
హలో అండి, నమస్తే.
హలో, నమస్తే.
మిమ్మల్ని ఇలా కలవడం నాకు చాలా ఆనందంగా ఉంది. బికాజ్ యునో యువర్ అన్ ఇన్స్పిరేషన్ నాట్ ఓన్లీ టు మెనీ విమెన్. నాకు కూడా మీ యూట్యూబ్ వీడియోస్ చూశాను, మీ గురించి చదివాను. సో యువర్ జర్నీ ఫ్రమ్ అ కన్వెన్షన్ గ్రాడ్యుయేట్ టు డేట్ ఇస్ వెరీ ఇన్స్పైరింగ్ అండ్ ఇట్ గివ్స్ యువర్ ఫీలింగ్ ఆఫ్ అంటే ఒక ఎంపవర్మెంట్ ఆఫ్ విమెన్ అన్నది కనపడుతుంది మీ దాంట్లో. So can you just elaborate about your journey?
So first of all, thank you for seeking this interview and making me feel so important. మీరు అన్నట్టు యాక్చువల్లీ ఇన్ రెట్రోస్పెక్ట్ నేను వెనక్కి తిరిగి చూస్తే ఆల్ ది వేరియస్ టర్న్స్ దట్ మై లైఫ్ టుక్, మై కెరియర్ టుక్, at the time that I was seeking that, it didn't feel like I was making some monumental decision. I sort of went with the flow. Always wanted to do something substantial. So something substantial annadi, by hindsight, I think has been very substantial, which I guess Amavar Daya ankovali. I don't think I consciously ever thought that I would be in this place one day.
కానీ ఇప్పుడు ఒక గ్రాడ్యుయేషన్ నుంచి ప్రొఫెసర్ నుంచి కమ్యూనికేషన్ ఎక్స్పర్ట్, అక్కడి నుంచి ఎంటర్‌ప్రెన్యూర్. సో ప్రొఫెసర్ వరకు ఏంటంటే ఓకే, అది నార్మల్ పీజీ అయిపోయి పిహెచ్డి చేయడం, రీసెర్చ్ స్కాలర్ వరకు. కమ్యూనికేషన్ ఎక్స్పర్ట్ కూడా బికాస్ ఆఫ్ యువర్ డిగ్రీ, దట్ వర్క్. హౌ ఎంటర్‌ప్రెన్యూర్ has come into the scene?
So let me begin from the beginning. Initially, like you mentioned, when I was married, I was a graduate. I think I got married right after my graduation. I sought to complete my PG after that. I think I gave my PG exams when my daughter was 1 year old, and went on. అప్పట్లో ఎలా ఉండేదంటే మై ఎయిమ్ వాజ్, లైక్ ఐ సెడ్, పెద్ద మాన్యుమెంటల్ డిసిజన్ తీసుకుంటున్నానని నాకు అనిపించలేదు. ఇంట్లో పిల్లల్ని చూసుకుంటూ ఏం చేయగలను ఆలోచించా. బికాజ్ ఐ వాజ్ వెరీ రిలక్టెంట్ టు అవుట్సోర్స్ దిస్ జాబ్ ఆఫ్ bringing up my children to somebody else. Even if it was my mother or my mother-in-law, I didn't want that. I wanted to be a hands-on mom. Ante. So ఆ పని చేస్తూ ఏం చేయొచ్చు అని ఆలోచిస్తే what came easily was continue to do academic pursuit, because that allows you to study from home. You don't have to go somewhere. MA I can do from home. I did it. Only exams అప్పుడు వెళ్ళి రాయాలి, రాశాను. Same thing with MPhil. ఇంట్లో ఉండి చదువుకోవచ్చు with minimum classes that I have to attend. I attended. Exams రాయాలి, రాశాను. PhD కూడా I could do it from home, and by that time my second child also had joined school, so that gave me a little bit of time. School lo unna sepo oka 3-4 hours of work I managed, where I joined for part-time teaching, because teaching is analogous to research, as you said. They go together. So I started taking university classes on a part-time basis. And I turned lucky anukunta, because although my job said that I was a full-time assistant professor, I convinced the management to convert it to a part-time job, and they agreed. And the reason I gave them was not that I had children, because I wanted, that's not a professional reason to give at all. What I said was I'm pursuing my PhD, which was also true. So while pursuing my PhD, I cannot do a full-time job, and they agreed. So I would teach part-time, do my PhD, and also be there for my children when they got home from school. So while most people have these two balances in life, work-life balance antaru, నాకు work-like academics, I have three balances in my life to juggle, and that continues to this day. At any point of time, ఒకటి ఎక్కువ వెయిట్ పుచ్చుకుంటుంది. Say for instance, if I thesis submission upward, probably I devoted a lot more time to my academic balance. And afterwards, when I join a new job, I devote a little more time to the job balance. And when a child falls sick, I devote more time to the personal life balance. So at any point of time, ఒకటి ఎక్కువ వెయిట్ తీసుకుంటుంది, మిగతా అవి లైట్ అయిపోతాయి. But that doesn't mean I don't get back to it. I do, which continues to this day. So I juggle all three and manage. So far, I can say that ఆ టైంలో నేను ఏది చేస్తున్నానో దాని గురించి అంత పెద్ద అనాలిసిస్ చేయకుండా ఏది అవసరమో చేసి ముందుకు వెళ్ళిపోతూ ఉన్నా. అంతే. I think when I want to pictorially represent the balance, it sounds like I made a conscious analysis and did it. It's not like that. మనకి ఇమీడియట్ జాబ్ టాస్క్ ఆన్ హ్యాండ్ ఏది చేయాలో అది చేయటమే, ముందుకు వెళ్ళిపోవటమే, అంతే. అండ్ ఇన్స్పిరేషన్ అంటారా, నాకు my source of inspiration has come from very diverse persons. Say, I know for sure that at the time when I was processing my PhD with two little children and also two in-laws at home who were aging and required, while health required some kind of attention from me, I had this maid at home, okay? And given my life, which begins very early in the morning to accommodate so many roles that I have to play, I sought a maid who would report to work at 5 in the morning, and I got one. Now this lady, I remember, మేము అప్పుడు ఎస్ఆర్ నగర్లో ఉండేవాళ్ళం, అక్కడ ఒక బస్తీలో ఉండేది. She would come from that basti, and she had a husband who would be a drunkard, who would beat her up sometimes at night, and he would come late, take away all her earnings for his drinking habit. అలాంటి వాడు ఉండేవాడు. అయినా కానీ in the morning, 5 o'clock, she would ring the doorbell and I would open the door and I would see her smiling at my doorstep. అంటే అంత ముందు రాత్రి ఏం జరిగినా కానీ she would turn up for work at 5 in the morning with a smile on her face. And that was a huge motivation for me,
Wonderful.
Wonderful. Yeah. And my life is so much more better than that. I don't have to put up with even 1% of the rubbish that she puts up with. And how can I complain on Picheli? Looking at her, she can't complain. How can I complain? So you can seek motivation from anybody, And when I was a student, I remember that I used to have this. This was during my undergrad days. I used to have a two-wheeler which I used to drive, and I used to go to a petrol pump to fill petrol for my two-wheeler. And there was this guy in that petrol pump, a youngster, and in between his filling, he would be with a book reading. So, ఒక రోజు అడిగాను నేను, what is it that you are reading, Ani, and why are you reading so much? And he said, లేదు, I come from a very poor family, and but I want to study. I'm very interested in studying. So I am keen on, I have somebody in my basti who teaches, and I attend those classes, and I want to finish. I want to be a graduate one day. So I was so happy to see that. And apparently he didn't have a place where he could keep his books at home. So our petrol pump owner allowed him to keep those books in one corner of his office in that petrol pump, and he would, long hours in the petrol pump, he would do it, and whenever he could manage, find some time, he would read. So మా ఇంట్లో ఉన్న పాత books, whatever I could do for him, I collected and gave it to him. And అప్పటి నుంచి I would see that I could help him in small ways by giving books, notebooks, zala. And he went on to do his graduation and do his post-graduation also in the B.R. Ambedkar Open University, and he's working now. The last I know, 20 years back, I ran into him and he was working as a sales executive somewhere. A very inspiring story. So no matter what the situation you are in, you can always make it better. That is my belief from these two examples that I have just quoted, and many others if you look around. But if you want to call it quits without even trying, that again is your prerogative. నేను చేయలేను, నా వల్ల కాదు, ఎందుకు చేయాలి, దోస్ ఆర్ క్వశ్చన్స్ నోబడి కెన్ ఆన్సర్ ఫర్ యూ. నేను ఇలాగే బాగున్నా, it could be that you don't want, you're lazy, it could be that you are scared to take on a fight, it could be that you don't want to face challenges. There could be many reasons. I cannot answer for the individual, but yes, if you want to better your life, you can, no matter who you are and where you come from.
అక్క, ఈ కాంటెక్స్ట్ లో క్వశ్చన్ ఉంది నాకు. చాలా మంది విమెన్ ఏమంటారంటే, మాకు ఇంట్లో ఎంకరేజ్మెంట్ ఉండదు, ఇంట్లో వాళ్ళు దే డోంట్ గివ్ అస్ దట్ స్పేస్ టు డూ అవర్ ఓన్ వర్క్ అన్నది. సో నేనేమంటానంటే, ఫస్ట్ యూ ప్రూవ్, యూ అట్లీస్ట్ లెట్ దెమ్ నో దట్ యూ వాంట్ టు డూ సంథింగ్. కొంచెం కష్టపడు దాని గురించి. వన్స్ యూ ప్రూవ్, వాళ్ళకు కూడా కొంచెం మోటివేట్ అవుతారు, ఓకే లెట్ హర్ డూ సంథింగ్ అని అనుకుంటారు అని నేను అంటాను. యాజ్ యూ వర్ సేయింగ్, అది ఇట్ షుడ్ కమ్ ఫ్రమ్ విదిన్ అనేసి. ఈ కాంటెక్స్ట్ లో అలాంటి వాళ్ళకి అంటే వాళ్ళ ఇంట్లో మోటివేషన్, వాళ్ళేదో వాళ్ళ పనులు అంటే, సరే ఈ పూట నువ్వు వంట చేయకు, నువ్వు వెళ్ళు అంటే బానే ఉంటుంది, నీ పని నువ్వు చేసుకొని ఇంట్లో, లైక్ మనం మగవాళ్ళకి ఎలా ప్యాక్ చేసి పిల్లలకి ఎలా ప్యాక్ చేసి పంపిస్తామో, sometimes yes, I also expect that kind of pat on the back from my family, but first it is me who needs to get up and do kada and prove. It takes time kada.
See, I cannot have a solution because it varies from home to home and individual to home. So నేను ఒక customized solution, I can't give you a sweeping solution, but then I can say one thing. I can quote what you just said, that yes, you finish your cooking, you pack for your kids. Now supposing you want to take on an assignment that asks you to leave home at 7:30 in the morning. All right. So what would you do practically? Instead of waking up at 6, you would wake up possibly at 4 o'clock. Whatever it is that you were doing, you would still do it. Instead of packing those boxes and making the meal ready by 7, you would probably finish it by 6. And still do it, still pack, leave it. Maybe, but you have done your job and then you go. Will your family say no to that?
Yeah.
They might watch you. In fact, on the contrary, ఆ విధంగా if you do it for about 15-20 days without complaint, with a smile on your face, do it like you've always been doing, like this lady who showed up at my doorstep at 5 no matter what, with a smile on her face. One day your family may surprise you by saying, all right, you've been working so hard for the last 15-20 days, take it easy this day, we will do the job, go. That's when the support starts coming in. You have to demonstrate your own seriousness before you expect support. You can't first support వస్తే నేను చేస్తాను అన్న కండిషన్ కన్నా, do it, just get along it. Remember it's like the Nike motto, do it,
just do it.
Yeah.
అంటే చాలా మంది ఏమంటే they wait for the approval of the family.
No, do it. You approve it yourself first. You approve what you want to do and demonstrate your seriousness. Motivate yourself first, and ఆ కాన్ఫిడెన్స్ తో చేసి నేను ఏదో చేస్తున్నా, బ్యాటిల్కి వెళ్తున్నా అన్న ఫీలింగ్ కాకుండా, డూ ఇట్ like a practical thing, like one more job. Like I remember there was this lady that I met long back. She's a Canadian. So at that time I was going through a whole lot of allergies in life. All right. They ran allergy tests and proved that I had a lot of allergies. She is actually an allergy specialist, but she said, apart from that, let me give you one tip. Imagine you're one of these women in the village with those huge baskets on their heads. All right. So that basket is such a huge basket. No matter what people pop at you, you just take a bow and take it. And no matter how heavy that gets, you still carry it. Imagine that with allergies. No matter what allergy comes, accept it, move on. Don't stop because of your, that's such a powerful image. I'm quoting that for many women that I meet. Go ahead. You go ahead with that smile, with that huge basket in your face. What people have brick bats for you? Thank you. People have bouquets for you? Thank you. Basket is there to take everything. You are unaffected by it. You walk. Ante. walk your path, whatever you've chosen to, with the same confidence. Don't slow down, just get going. Ante.
And empowerment is your choice. It shouldn't be a
You
sacrifice.
empower yourself. Nobody.
Right.
Why are you entrusting an external person to empower you? Why are you not empowering yourself? You empower
Yes.
yourself before others
And
get the right
start
to do
doing
it.
whatever you can and wherever you are. First,
What
to
you
begin
want.
with.
No, start doing what you want to do. If
Mm,
the choice, if your choice is to be a homemaker, do it. Who's stopping you? I
mm,
mean, that's also a rightful choice, and
mm.
that's a choice only a woman can make, right?
Right.
I used to teach, like you said, I was a
Mm,
professor once. I used to
mm,
teach, and
mm.
I used to teach in an engineering colleges, JNTU, OU, ANI. I had see this distinct difference between girls and boys who come to the fourth year, final year of engineering.
Right.
The boys would have this worry, and gaddal misal pencheskunevaru.
Mm,
I'm going to leave the cocoon of the four walls of this college in a few months. All right, I have
mm,
no idea whether I will get my MS with the aid to go abroad, whether my visa will be processed, or whether I will get a campus placement that I want. But in any case, from a few months, I'm on my own. I have to contribute to my family's earnings. I cannot ask my
right.
dad anymore.
Mm,
Most boys would be of
right.
that.
Exactly.
Girls would, on the other hand, happy ఉండేవారు. They have all the options. They want to study more, they can. They want to work, they can. They want to get
Mm,
married, they can. They can refuse. They want to go abroad, they can. Well, they have multiple choices ఉన్నాయి వాళ్ళ లైఫ్లో. ఏది
mm,
చేసినా
mm,
ఎవరు తప్పు పట్టరు.
mm.
Boys, what choice do they have?
Yes.
వాళ్ళకి, when you talk about gender discrimination, it works both ways. You know,
Right.
అప్పుడు this feeling I had when I was teaching boys and girls of that age. In fact, society has, in current situation, society has cast men and boys in a harsher mold than women.
True.
Earlier
True.
it was the reverse, which is true
Mm,
till a generation
mm,
back, but not for
mm.
the current generation. It is the girls who have more freedom of choice, to voice, to walk, to carve a path for themselves. Boys have no such choice. I don't see any man complaining that that they don't like the job they do, and they complain. Yeah, but what can they do about it? They have no option
Right.
there.
Right.
But women, we don't like a job, we chuck it. We'll find some another very easily, because
Right.
we are not compelled
Mm.
to earn the family's bread. The man
Yeah.
is.
Right. Mm,
So manakuన్న choice menki ledu, unfortunately, and we have no right to complain as much as we do. Honestly, that's my personal opinion.
mm,
Of
mm.
course, it's very subjective. Not all women have the kind of supporting environment that I had. But yes, why complain? I have all the freedom in life to do what I want to do, what I'm serious about, what my passion is, and I do it. That's
Mm.
how I have transgressed from being a professor to getting into the corporate world. At any point of time, నాకు ఏదైనా ఇది చేస్తే బాగుంటుంది అనిపిస్తే చేశాను.
Mm.
Uh, the luxury that I have as a woman, I've exercised.
Exactly, because we don't have that compulsion that you should earn
Yeah,
for the
so
family.
so
Yeah.
now I wanted to be an entrepreneur. I have become an entrepreneur.
Mm.
Well, my first venture was not very successful, but my second venture is successful,
Mm.
and I'm enjoying the success.
Wonderful. Congratulations on that.
Thank
And
you.
actually, entrepreneurial abilities, and that too, you were not young when you started this.
No, I wasn't.
So,
It was only
how did
yeah.
it happen? From where did you get that idea?
Well, I think it's just that as we age, a lot of other interests develop in us. We want to do, మనకు చాలా ఐడియాలు అయితే వస్తాయి, దాని గురించి ఏం
Mm.
చెయ్యము.
Mm.
నేను చేద్దాం అనుకున్నాను. I
Mm.
was teaching was fine. After a
Mm.
point of time, it no longer seemed as interesting, because um, my children went on into high school and so on to college. So teaching, the advantages that I had with teaching, in the sense that, I have the same holidays as the children have. Academic
Right.
institutions all have a
Exactly.
summer available.
Exactly.
Those were, and summer holidays, which
Mm.
coincide with the children's holidays. Those were the
Mm.
distinct advantages, and I
Mm.
actually enjoyed teaching. I enjoyed research more. So then I
Mm.
thought, all right, let me continue with the research, but get into corporate, which I did. Then
Mm.
after that, even as an entrepreneur today, I continue with my research. Every once in a way,
Right.
I do publish. I
Right.
That I have not given up.
Mm.
Teaching I do now, but not as a profession, more as
Mm.
a
Guest
talk here, a
faculty
talk
kind of
there.
thing. Yeah.
Yeah,
Okay.
something like that.
Mm.
But I don't do it on a consistent professional basis.
Mm.
Um, Entrepreneurship has its own challenges. It's like
Mm.
nurturing a baby, if I can put it that way. And it's nice to see that baby grow and walk and run. The same kind of feeling in entrepreneurship, and it's fun. And I think the Indian economy and the kind of the economic state that we're in supports
Mm.
entrepreneurship, especially
Right.
women entrepreneurs. And
Right.
I wanted to taste that, so that's why
Mm.
I'm in this.
Okay. And did you face any challenges as a woman all through your careers?
Yeah,
Uh,
I think, rather than say that I faced it as a woman, I would say I faced it as a person. See,
mm.
say for instance, a typical scene, when I'm very busy with my career, I leave home at
Mm.
8:30 in the morning, and I come
Mm.
back again by 6:30, and I have
Right.
another job waiting at home. So
Mm.
in those kind of situations, in a mundane woman's life, what are the challenges you can have? You can have a sick child, you can have a sick parent, you can have a sick
Mm.
in-law, you can have the
Mm.
maid not come, for whatever
Mm.
reasons she has in her own life,
Mm.
but it affects
Mm.
my life.
Right.
The assembly line kind of atmosphere at home. First this, that gets affected
Right.
when a person who works for you doesn't turn up. These are the everyday challenges that you face. But
Mm.
then, what can you do about it?
Mm.
You can complain about it, or you can adjust, or you can
Mm.
demand that the family adjusts, or you can just get on with the job. You know, okay, fine. I have these dirty dishes waiting for me because my maid
Mm.
didn't turn up. I can pretend they don't exist and just order food. I can do that maybe for one evening, but can I do it for the second day, third day? No, I'll have to
Right.
tackle it. So my
Right.
approach to it was, I wouldn't wait. I
Mm.
wouldn't wait for that pile to get bigger and bigger and bigger on the third day and have such a big task that I can't handle it anymore.
Right.
అదే
Mm.
రోజు అదే పూట finish it. So it's a smaller
Mm.
pile. Get on with it. So probably I
Mm.
would go to bed half an hour later, but at least the
Mm.
job is done. I don't
Mm.
have that waiting for me when I wake up the next morning.
Yeah. It's
I'm
not in the
giving you an
mind.
example, but that's
Mm.
how I tackle. I'm very practical that way. I don't like to my piles to get bigger with regard to
Right.
anything, dirty dishes or
Mm.
whatever, or my
Mm.
office work. I finish it on that day. I have a very strict task list, which I write. I use a diary where I write my task list, to-do list for the day. It could be an office task, it could be a personal task, it could be a grocery task, whatever, and I finish it by before the end of the day. By and
Mm.
large, I finish most of it, at least. So that it's not waiting for me. That task, the
Right.
next day's task list is the next day's task list. So that's
Mm.
how I get on with whatever I think is my work. It's a job that I have identified, and then I think the onus is on me to finish it. If I have decided that I want to be a mother, it's my job to be a good mother.
Mm.
um, if I have decided to work, it's my job to work as well as best as I can. If I've
Mm.
decided to be an entrepreneur, then it's my job to be as good an entrepreneur as I can be. I have
Right.
identified the job. Why can I can't blame somebody else, because you didn't support me, I didn't do this. You didn't let me do this. So who's letting whom do what?
Right.
you
Right.
know
Exactly.
yeah. That gets a very gray area to tread on, and I would rather not get into that gray area. I've identified this. I'll do it. I'll finish it.
It is 100% responsibility taking, when taking 100% responsibility of your choice.
Yeah, and freedom is a double-edged sword. When you talk
Yeah.
about freedom, you also have to talk about responsibility.
Mm.
You can't, like, I can quote an example. This was an
Mm.
example that I used to listen to these Sunday lectures at Ramakrishna Mutt, which Swami Ranganathananda used to give at one time.
Right.
And he took this
Mm.
example. I'm repeating that
Mm.
example that he says, what is freedom? You listen to Allah Raka Khan playing the tabla, and you
Mm.
or Zakir Khan, his son, playing the tabla. You say how freely he plays, but
Mm.
do you realize how many years and years of very rigorous riyaz, disciplined
Right.
riyaz or practice went
Mm.
into producing
Mm.
that freedom?
Right.
It's
Exactly.
years of rigorous that extreme rigor. So
Mm.
that's my Siri, which I've activated, I guess. So it's that years of rigorous discipline that has gone into producing the freedom of the tabla player, or the freedom of somebody playing a flute or a santoor or whatever.
Mm.
How many years of rigor has gone into that to
Right.
produce that? What
Mm.
we see is the end result, the freedom. What you see
Right.
in me, I have
Right.
exercised freedom of choice in getting to the place where I am. But it has been little things that have gone into my life. A
Right.
habits like, no matter what, I wake up at 5 the next
Mm.
day morning. No matter how
Mm.
late I have gone to bed, no matter how sick I feel, no matter how sick a child I have at home, or a parent or an in-law that I have to take care of. No matter what I do, I wake up at 5 the next day morning, no matter what. So
Mm.
it's rigorous little things that I have practiced that has led me to the kind of freedom that you see in front of you. Which at the time that I was laying down those ground rules, I didn't think of them as rules. I just thought that, all right, I have my task list for tomorrow is this long. So unless I wake up at 4 in the morning, I'm not going to finish it. So no matter what time I sleep, I wake up. And definitely I can't sleep early when I'm pursuing a PhD. I have
Right.
to burn the midnight oil to document all that my research
Right.
requires me to do. So very often I would
Right.
sleep for only 2 hours or 3 hours in the night,
Mm.
or I would sleep for that 1 hour of commute to work. I was
Mm.
teaching, so my college was an hour away, and then that one
Mm.
hour that in the vehicle I would sleep. So I would
Mm.
catch up with my sleep in different ways, but my work life would continue, like, even whether I slept or didn't sleep, nobody would know. It's
Mm.
my secret. I don't have to. The world doesn't have to know that I didn't sleep the night.
Mm. So no
So,
matter what you are, you should show up for the show. You should make up for
yeah,
the show.
like that maid who showed up at my doorstep every morning with a smile, no
Mm.
matter.
Mm. And can you tell us about your company, Argala?
Argala, all right. Argala is a home healthcare company. We Now home healthcare is a space that got identified. Where I would not that it didn't exist before. It became more sharply identified during the COVID times. People
Mm.
understood that
Mm.
there is so much you can do in the home healthcare
Oh,
space.
right.
So Argala has physician-led programs. These are doctor-led
Mm.
programs, not nurse-led
Okay.
programs.
Mm.
In the sense, like, if there is a person who's discharged from hospital after a surgery
Mm.
of due
Mm.
to prolonged hospitalization,
Mm.
then we we have our doctors going home for ensuring that the continuum of care is ensured at home after discharge from the hospital. Wound
Okay.
dressing, or the checking of the vital, the physical examination. If they have comorbid conditions like diabetes or sugar or hypertension or thyroid, or
Okay.
connecting them with a super specialist on virtual consultation mode, ensuring that they recover faster, because
Right.
their recovery is important for the family as well. Now you have
Right.
double
Right.
income families, both husband
Mm.
and wife working. They need to get back to work. When the person is in the
Right.
hospital, they take leave. But
Mm.
after coming back home, they have to get back. So the faster that the person recovers, the faster the normalcy is restored in the whole family.
Right.
So we take care of that. And the other kind of program that we do is called parental care program, where you have
Okay.
children. These days, you have children who are mostly abroad, and the Indian
Right.
cultural situation require. We are programmed to understand that, culturally sensitized to understand that children take care of their parents when they age.
Right.
But what if the children are not here at all? Now, that's a
Hmm.
situation which is unpleasant not only to the parents but to the children themselves. They are very
Oh,
guilty. It's
right,
not that
right,
they're happy. It's
right,
just that the situation has warranted their being abroad, but they're not happy about
right,
it either. They're very guilty.
right.
So how can we address this? So we
Hmm.
step in there. So the children subscribe to our parental care program, where we have
Hmm.
a doctor visiting the parent periodically, maybe twice, thrice a month, or even once a
Hmm.
month, as per
Hmm.
the requirement, and ensuring, for little things that requires medical attention, our physician, a family physician, is able to take care of them, and supply medicines at home, link them with specialists, monitor their diabetes through home sample collection, where the phlebotomist comes home and collects sample, and the report is analyzed by our doctor, and therefore their medication is compliance is taken care of. They are linked to other super specialists on virtual
Okay.
consultation board, where our doctor goes there and then links. So they are not, the
Okay.
parent is not required to navigate an app or whatever. Our doctor does it for
Okay.
them,
Okay.
coordinates with the specialist to ensure that their other comorbid conditions are managed very well. And in short,
So
I'm
everything,
summarizing
every
what
medical need is taken care of.
every except those that definitely require to go to the hospital, like
Ah.
radiological investigations,
Hmm.
like x-rays, MRIs, CT scans can't be done at home.
Hmm.
Surgeries can't be done at home.
Right.
So except for those kind of requirements where they have to
Hmm.
go, then too we coordinate. We ensure that
That's what
the
I'm
parent
asking.
is,
You take
yeah, we
care of that
coordinate
also, like you accompany
that.
them,
Yeah,
coordinate them. Yeah.
we
So,
coordinate the transportation to the hospital and back.
ah, and for the children, they can be ensured that the parent is
Yeah, they
taken
don't have. Yeah,
proper medical
yes.
health care.
We are like a
And
foster family, foster children for the parents.
right, right. And for the post-operative care and all that, what you're providing, do you have in-house services also, or it's
Like
just a
in
visiting? In-house and
no,
nursing care, especially.
so nursing care, where it is required as part of our program,
Mm,
we provide.
mm.
Our Mainly our programs are led by physicians and physiotherapists, rehab specialists.
Okay,
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 so nursing is a part of it, where some IV injections or IV fluids have to be administered, catheter management, wound dressing. There, the employer nurse.
okay,
But if you're
okay.
talking about pure nursing services, where
Ah,
the nurse has to stay with them, then we will rope in another party to do it. We don't undertake
okay,
pure nursing
okay,
services.
okay. And the last question, Andy, communication skills, in which you are an
Okay.
expert. So,
Not
I feel that is
expert.
what is lacking. Especially
Um,
for youth and సరే the younger middle generation ఏదైతే ఉంటుందో అసలు they are not able to bridge also between the older generation and younger generation because scenarios are totally different, environment is totally different. So how do you think we can better our communication skills?
um, on the one hand, if you look at it, the kind of change that the current generation we have witnessed, rather,
Mm,
a change from offline to the online, the digital mode, the digital
mm,
transformation, that I think is responsible for the huge gap that you see.
mm.
That on the one hand. On the other hand, you no longer have families where three generations are staying in the same house.
Right,
When you had that, there would be lesser communication bridges to cross, because they're living
right,
in one home anyway, and there
right,
would be interaction.
Right.
Now you have nuclear families where you have one generation or at the most two generations in one home, not three
Right.
or four like it used to be earlier. So this is the
Now.
other reason why you have a breakdown of communication. So when you do encounter the other generation, you don't know how to talk to them.
Right.
They don't know how to talk to them. It's not just one
Right.
way; it's the other way too.
Right.
A generation ahead before us, they are not used to mobile phones, to texting or whatever.
Right.
That is the mode of communication with the current generation. But it's like a joke. If I call them, they may not respond. You text them, they will respond. You know,
Right. Exactly.
uh, I think there is, although you can go on and about telling the other generation, like, stop doing that, put your phone down and talk. But the fact remains that um, we also have to bend and probably do that. Why do we expect them to change and fall in line with our requirement? Let us also fall in line with what they require. Get online with them. you know I'm
Right.
leaving the home early at say 8 o'clock. I can't expect my children, because the current generation don't sleep at night, they wake up late the next morning.
Right.
I
True.
can't expect them to be up and speak to me before I leave. I reach
Right.
office. I
Right.
may catch up with the day on phone or on text with them. The
Right.
point is to communicate with them in whatever
Right.
way I can, rather
Yeah.
than curse the digital age. Embrace it. That would be my advice. Embrace that
Okay.
age.
Hmm.
Learn the ropes of that and communicate. Use it to your advantage.
Right. Wonderful. Wonderful. I think it is a very big message to the current generation. I mean, I'm not speaking about the younger generation, maybe, uh, generation before the technology. Hmm.
Yeah, that generation is a little obsolete, and it's difficult, but make I think the attempts have to be on both the sides. We have to teach them how to use a mobile, how to navigate a smartphone, and they have to be willing to learn to also.
Willing to learn. Yes. They need to be more open to that. Thank you, Akka. Thank you very much for your
Thank
wonderful
you for having me on your show.
words.
It was a pleasure talking to you. Thank you, and I hope I added value.
Yeah, sure, definitely. And there's a lot more to talk actually. Due to constraint of time, I'm just putting it off here. But maybe I hope we'll catch up some other time with some more
Right.
topics with you.
Sure, it would be a pleasure. Thank you.